see you. How can I help you?
The doctor just came in and saw me and told me the results of that lipid panel that we had taken, and he says I have high cholesterol, but I feel fine and healthy. And then, I mean, he even gave me a medication and a torvastatin. I mean, I've never even heard of that. Like, what does that do?
Let me take a look here. Okay, yeah, atorvastatin. Atorvastatin is a cholesterol-lowering drug, okay? So normally the doctor would put you on this drug if you have over 150 milligrams per deciliter of LDL cholesterol, which is bad cholesterol. And he'd put you on this drug to help prevent hardening of the arteries, which is called atherosclerosis, okay? And can prevent coronary artery disease. So let me tell you a couple cool things about this drug. Atorvastatin works by inhibiting an enzyme. Now, this enzyme's a mouthful, okay? It's called hydroxymethylglutarol coenzyme A reductase enzyme, all right?
Okay.
Now, let me tell you what it does, okay? It inhibits this enzyme, and this enzyme is actually on the hepatic cells, which are the liver cells. Now, the liver cells respond by making more of the enzyme, which actually decreases cholesterol. Now, the liver cells make more of the receptors for this enzyme at the same time. So when the blood filters through, it actually can take out the cholesterol, filter out the cholesterol. So this is going to lower your cholesterol, and it's actually going to increase your good cholesterol, called HDL cholesterol as well. Do you have any other questions?
Well, yeah, no, I mean, that helps me understand it. I mean, I get why he's prescribing it, but it seems like things like that, you always hear commercials with crazy side effects. I mean, is this going to cause anything like that?
That's a great question, yeah. So there are a few things that are very common. You don't need to worry about it really, but diarrhea is common. Also, urinary tract infections is another common thing. You might also get some pain in your extremities. That's very common. Now, let's talk about some more serious side effects that you definitely want to watch out for. This includes rupture of a tendon. It's very serious. Also, increased liver enzymes or liver failure, so we will be monitoring for this. Also, signs of systemic lupus or even a cerebral infarct can occur. So these are all very serious signs. You want to give us a call, you want to call 911, you want to stop the drug, and we'll put you on something else to help you out.
Okay. Well, I guess I'll just, keep coming to my checkups and, you just watch for those serious ones. Well,
yeah.
Thanks a lot. I mean, that helps me understand a lot more of why he's giving this to me.
Great. Okay. Well, have a nice day then.
Thank you.
My name's Gabby, and I'm Kiara's nurse, and I'm going to be talking about a medication she's on called nifedipine. So you presented with a history of hypertension, and you came into the clinic complaining of chest pain, saying that it felt like something was sitting on your chest. And you also stated that the pain only occurred upon physical exertion. And once we did we measured your blood pressure, and it was 160 over 100, which is very high and absolutely hypertensive. And the physician, I know you saw a physician, and he diagnosed you with angina and prescribed you an initial dose of 30 milligrams of nifedipine, and it could be increased every 7 to 14 days if necessary.
So what will my dose be eventually?
It will increase incrementally, so it might be 60, it might be 90, and the maximum dose is 120 milligrams per day.
Okay. Can you tell me a little bit about how nifedipine works?
Yeah, well, first I want to talk about calcium channels. So basically, the way the calcium channels work is they affect muscle cell contraction through allowing calcium into the cell, which then propagates the action potential. So nifedipine works by being a calcium channel blocker. It inhibits the contraction of the muscle cells through blocking calcium. And what this does is it dilates coronary and systemic arteries. Ultimately, nifedipine causes a relaxation of the heart and blood vessels. So there's an increased supply of blood and oxygen to the heart. And that's really important for you because you have a decreased supply of blood and oxygen to the heart due to constricted vessels, and so nifedipine is going to help to dilate these vessels so more blood and oxygen can reach your heart.
Are there any extra side effects?
Yeah, there's a few side effects. The most common ones are peripheral edema, nausea, vomiting, like flushing, headache, and heartburn.
Okay, thank you. That's really helpful.
So hi, my name's Gabby. I'm 45 years old, and I have congenital aortic stenosis, and I just had a mechanical valve replacement surgery of the aortic valve, and I have 2 children. I'm not planning on getting pregnant again, so I take IUD as contraception.
Hi Gabby, my name is Masha, and I'm your nurse. Please tell me who you
Dr. Stanley said that the surgery went really well, and my only concern is formation of blood clots. I've heard that plaque can sort of accumulate and on like the replaced valve.
You are correct, and that's why I need to discuss a few things with you. Dr. Stanley has prescribed a blood thinner for you to take for the rest of your life. You will start with a 2 milligram oral tablet once a day. I see that your family has already picked up the prescription at the pharmacy.
Yeah, am I taking Coumadin? My husband takes Coumadin.
Warfarin is a generic version of Coumadin. It contains the same active ingredients. We will have to monitor your INR, or international normalized ratio, to monitor your blood's ability to clot.
Okay, and how does Coumadin work, and like what are some of the side effects I might expect to have?
Coumadin or warfarin works by blocking the formation of clotting factors that depend on vitamin K. This will prevent the formation of harmful clots and prevent clots from getting larger. Since foods like green leafy vegetables, lettuce, and broccoli contain vitamin K, make sure not to increase intake of these foods. You can keep your current diet, but please notify Dr. Stanley before making changes to your diet. It is very important that you notify Dr. Stanley of any signs of bleeding. Avoid taking alcohol, aspirin, and acetaminophen. Don't take any prescription drugs, OTC drugs, as well as herbal medicines and vitamins unless you consult a doctor first.
Okay, and thank you. And I'll always keep my medical alert bracelet on, and I'm going to try and avoid like hurting myself or running into sharp objects because to decrease the risk of bleeding. And I will call you and report if I'm like nauseous or like I'm vomiting or I have severe headaches or like sort of unusual bruising.
Yep.
Hey Grandpa,
How's it going?
it's Ethan. I talked to Grandma, and you know I'm in nursing school now, and she wanted me to come and talk to you about taking your beta blocker.
Yeah, she would. She knows I'm sitting down watching Judge Joe Brown.
Let's talk about propranolol today. Is that okay?
Yeah, we talk about profound.
All right. Well, I just really want you to take your beta blocker. It's really good. It's going to go ahead and help you with some of your problems you've been having.
I got river flukes in Vietnam. I don't have to take no propanol.
I understand that, Grandpa, but what I'm talking about right now, I'm talking about your angina, your hypertension, you also got those migraines,
Yeah.
dysrhythmias, and this can help you, all right?
Yeah.
So do you know your dosing that you're supposed to be taking?
Bottle in the pill.
Okay. For your hypertension, you should probably take 120 to 240 milligrams per day. And your doctor's going to want you to cut that up to 2 to 3 divided doses. Do you understand that?
2 to 3 doses.
Okay.
Yeah.
This is really a great drug, propranolol, or Inderol as the trade name says. It's highly lipid soluble. First pass, unfortunately, it's just about 30%, but it's one of those non-selective beta blockers that works on both the beta 1 and the beta 2 cells. Did you know that before, Grandpa?
Well, I knew the beta blocker.
Okay, that's good. But I just want to make sure you're not taking any of your calcium channel blockers, right?
No.
It's good, because if you're taking some calcium channel blockers, you can have excessive cardiac suppression, and that would be really bad. So, Grandpa, are you having any adverse effects from the propranolol?
I don't think so.
You're not getting any dermatitis,
No.
dizziness, fatigue, and you don't have any asthma, correct?
No.
And you never had any heart blocks?
No.
Okay, good.
Okay.
All right. And most importantly, there's a black box warning on this drug. So if you abruptly withdraw propranolol, you can get angina, myocardial infarctions, heart attacks, and arrhythmias.
That'd be pretty bad.
That would be pretty bad, Grandpa.
Propranolol? I learned about that in midwifery school.
Yeah, every time somebody come in here and talk about medical stuff, you know what's wrong with midwifery.
Thanks, Grandma. All right, Grandpa, are you going to take your propranolol?
Hey, right after Judge Joe Brown.
All right. I love you, Grandpa.
I love you too. Hey, Ethan, you all right, man? How's your shift going?
It's going horrible. I've got clinicals today, and then there's that farm test, and I don't know anything about digoxin.
What do you need to know?
What about the mechanism of action?
It's a cardiac glycoside. It's the only one in the U.S. It's a natural product from the digitalis plant. It's a positive inotrope, and that means that it increases cardiac contractility. Now, it works at the cellular level by inhibiting the sodium-potassium pump. So sodium inside the cell is going to increase. That has a secondary effect of making calcium inside the cell increase. And you obviously remember that calcium is important for muscle contractions. So now, when the heart is told to beat, the muscle fibers within the heart are going to react together and have more interaction, increasing the strength of contraction. This is going to increase cardiac output.
Oh my God, you know so much. Do you know about the drug interactions?
We know that potassium is really important for the heart, so a lot of the drug interactions are going to deal with that. Loop diuretics, thiazides, things like that are going to decrease our potassium levels and increase the chance of digoxin toxicity. So we're going to want to give something that's potassium sparing, like spironolactone. Also, ACE inhibitors or ARBs, those are going to increase potassium. Those could actually decrease the effect of digoxin, so you don't want to give any of those. And then there's a couple of calcium channel blockers like verapamil or diltiazem. You want to stay away from those because they'll increase the plasma levels of digoxin, and that can maybe lead to toxicity.
Fudge! I don't even know about dosing right now, and you're talking about these other things?
Digoxin has a really narrow therapeutic window. Our average range for an adult is going to be like 0.125 to 0.25 milligrams. And because of that narrow therapeutic window, you want to make sure your patients know that if they happen to miss a dosage, they don't try to double up to make up for it. Also, before they take a dose, they want to check their heart rate. And if they're below 60, they don't want to take a dose, they want to hold it. Another thing is high fiber foods. These are going to decrease the efficacy and absorption. So they might want to think about taking it an hour before a meal or in between meals to get the best effect.
Wow, man, this is really helpful. You wouldn't know anything about adverse effects, would you?
The standard adverse effects are actually pretty mild. I mean, headache and maybe some dizziness might occur. What you really want to watch out for is things that are uncommon, like if anorexia develops or maybe vomiting and fatigue, and especially yellow vision. These are signs that there's a developing toxicity. But it's really not that common. I mean, toxicity lives to dysrhythmias, but you really don't get to acute toxicity until 2 or 3 milligrams. It doesn't become life-threatening until about 5 milligrams, and cardiac arrest usually doesn't happen until you're over 10 milligrams.
Hey, thanks, Sean, for your help.
Oh, anytime, man. Anytime I can help.
Hey, what's up, guys?
Hey,
Jason.
Fudge.